Ever wondered why sudden changes in your body should never be ignored? It's a question that bears more weight than you might think. Our bodies are intricate machines, constantly communicating with us. But sometimes the messages are silent and subtle, like whispers in the wind. Among these whispers lurks a silent threat: early-onset colorectal cancer. It's a menace that often goes unnoticed until it's too late. But there are signs, 4 red flag symptoms to be precise: abdominal pain, rectal bleeding, diarrhea, and iron deficiency, anemia. These symptoms could appear as early as 2 years before a diagnosis, silently heralding a potentially life-threatening condition. The more symptoms you have, the higher your risk. It's crucial to understand these symptoms, not just for us, but for healthcare providers as well. Why? Because early recognition can lead to earlier diagnosis, less aggressive treatment, and improved patient outcomes. It's time to delve deeper into these symptoms, for your health could be sending you a critical message. Abdominal pain, a common discomfort or a serious alarm? This question is more significant than you might think. Abdominal pain, a sensation we've all experienced, can range from a minor annoyance to a severe, debilitating condition. It's a tricky symptom, often dismissed as a mere result of overindulgence or a bad meal. But when it persists, it can be a warning sign of something more grave, like early-onset colorectal cancer. But what exactly is abdominal pain? It's a discomfort or distress felt anywhere between your chest and your groin, often referred to as the stomach area or belly. It can be sharp, crampy, dull, intermittent or constant. It can come and go or remain steady. This wide range of manifestations makes abdominal pain a tricky symptom to comprehend and interpret. Now you might be wondering, how does this relate to colorectal cancer? Well, new research has identified persistent abdominal pain as one of the 4 red flag symptoms associated with an increased risk of early-onset colorectal cancer. It's not just a symptom of a bad meal or a demanding digestive system. It could be your body's way of waving a red flag, signaling that something is seriously wrong. The significance of abdominal pain in relation to colorectal cancer cannot be overstated. It's crucial not to brush it off as a mere inconvenience. Early-onset colorectal cancer is often diagnosed in emergency rooms, with significant diagnostic delays due to the dismissal of these symptoms. Early recognition and prompt attention can lead to earlier diagnosis, less aggressive treatment, and improved patient outcomes. So, the next time you feel that familiar discomfort in your belly, don't just reach for an antacid and ignore it. Listen to your body's signals. Persistent abdominal pain is not just a common discomfort. It's a serious alarm that should not be ignored. Remember, persistent abdominal pain demands your attention and possibly a doctor's examination. Scene script? Spotting blood where it shouldn't be? It's time to raise the red flag. Rectal bleeding, a disconcerting symptom, is often dismissed as an inconsequential issue. You might attribute it to something as benign as hemorrhoids or a minor tear. However, it's crucial not to overlook this red warning sign. The presence of blood in your stool or on toilet paper can indicate more serious health issues, including colorectal cancer. Let's delve a bit deeper. Rectal bleeding is not a disease in itself, but a symptom of a problem in the lower gastrointestinal tract. The causes can range from anal fissures and hemorrhoids to inflammatory bowel diseases and, yes, even colorectal cancer. The color of the blood can provide clues about the source of bleeding. Bright red blood generally suggests the bleeding is low in the colon or rectum, while darker blood may indicate a source higher up in the gut. Why is rectal bleeding significant, you ask? Here's why. It's one of the 4 red flag symptoms associated with an increased risk of early-onset colorectal cancer. Research reveals that these symptoms can appear as early as 2 years before a colorectal cancer diagnosis. The more symptoms a person has, the higher their risk of the disease. Among these symptoms, rectal bleeding and iron deficiency anemia are particularly urgent indicators for further screening. Now let's talk about its connection with early-onset colorectal cancer. The majority of colon cancer in younger patients occurs on the left side of the colon, which may explain why bleeding is more noticeable. This bleeding could be an early warning sign of a cancerous growth in the colon or rectum. The key takeaway here is urgency. It's crucial for both patients and healthcare providers to be vigilant about these symptoms, as early-onset colorectal cancer is often diagnosed in emergency rooms with significant diagnostic delays. Prompt recognition of these symptoms can lead to earlier diagnosis, less aggressive treatment, and improved patient outcomes. Ignoring rectal bleeding could be a grave mistake. Timely action can make all the difference. Diarrhea and anemia. Are these routine health issues or signs of something more sinister? It's a question that deserves a closer look. Diarrhea and iron deficiency anemia, to most of us, might seem like ordinary health concerns, but they could be more deceptive than you might think. Let's start with diarrhea. This unpleasant condition is something we've all experienced at some point. Often it's a result of a digestive issue, perhaps a reaction to something we've eaten, or a symptom of a short-term illness like a stomach bug. However, persistent diarrhea, especially when accompanied by other symptoms, should not be overlooked. It could be an indicator of a more serious underlying health issue, such as early-onset colorectal cancer. Now let's talk about iron deficiency anemia. It's a condition that occurs when your body doesn't have enough iron to produce the necessary amount of red blood cells. Symptoms can include fatigue, pale skin, and shortness of breath. But it's not just a lack of iron in your diet that can lead to this condition. Iron deficiency anemia can also be a symptom of internal bleeding, which could be a sign of early-onset colorectal cancer. The link between diarrhea, iron deficiency anemia, and early-onset colorectal cancer is not to be taken lightly. Both symptoms can manifest as early as 2 years before a colorectal cancer diagnosis. This underlines the importance of paying attention to what your body is telling you. The deceptive duo of diarrhea and iron deficiency anemia can seem like common health issues. But if they persist, it's crucial to seek medical advice. Understanding these symptoms and their potential implications can lead to early detection, and early detection can make all the difference in treatment and outcomes. So, the next time you brush off persistent diarrhea or fatigue from anemia as just another run-of-the-mill health problem, remember this. Diarrhea and anemia may seem common, but if persistent, they could be your body's cry for help. Now that we've uncovered the red flags, let's answer some burning questions. Are you wondering why early-onset colorectal cancer is of such concern? Well, it's because this type of cancer is often diagnosed late, usually in emergency rooms, leading to aggressive treatments and less favorable outcomes. The earlier the diagnosis, the better the prognosis. So it's critical to be aware of these 4 red flags: abdominal pain, rectal bleeding, diarrhea, and iron deficiency anemia. Some of you might be thinking, could these symptoms indicate other gastrointestinal health issues? Absolutely yes, these symptoms are not exclusive to colorectal cancer and could be signs of other health issues that need attention, but their presence should definitely prompt further investigation, especially if they persist. Now, a question that often comes up is, why are rectal bleeding and iron deficiency anemia particularly urgent indicators? It's because the majority of colon cancer in younger patients occurs on the left side of the colon. This location may make bleeding and anemia more noticeable, so these symptoms are often a strong indicator that further screening is needed. A common myth is that young adults don't need to worry about colorectal cancer. However, recent studies have shown an increase in early-onset colorectal cancer. It's essential to understand that no age is immune. Lastly, can these symptoms appear years before a diagnosis? Yes, indeed. Research shows that these symptoms can appear as early as 2 years before a colorectal cancer diagnosis. This highlights the importance of being vigilant about your health and seeking medical advice when something feels off. Knowledge is the first step towards prevention. Stay aware, stay healthy.